Hi, my name is Helen William. My partner and I will be talking about mental health awareness. So, what is mental health? Mental health involves social, psychological, and emotional health. It's all the aspects of our psychological health that affect our general well being. Mental health is distinct from mental illness. Mental illness are the health conditions that involved in changes in emotional thinking, behavior, or a combination of these things. And mental illnesses are associated with distress, problems functioning in social activities, work activities, or family activities. And examples of mental illnesses would be depression, schizophrenia, anxiety disorder, and things like that. And we'll talk about why mental health is important. Mental health is important because it affects everyone. Everyone has mental health. And it's an important part of our health that's often neglected. But just as we take care of our physical health, we also need to take care of our mental health so it doesn't deteriorate to a point where we start having problems.
Okay, so Helen has explained that there is a difference between mental health and mental illness. And while that is true, it's also very possible for a person to have mental health problems without having like a mental illness. And here are some factors that can contribute to a person having mental health problems. And some of those factors include childhood abuse, social isolation, or loneliness. And this was something that we saw during the COVID-19 pandemic lockdown when people began to struggle with their mental health because they had like very minimal social interaction. And so it's very important to just have a strong social support to make sure that you're not staying isolated and your mental health is not being affected. Experiencing discrimination and stigma, including racism, can also impact a person's mental health. And I think this is very important for recipients of this kind of these actions to know what this can do to them, and for aggressors to also know that to understand the impact of their actions on people. Bereavement is also a very significant event that can impact a person's mental health. And basically, when a person loses a loved one, it's very painful, it's very hard. And I'd like to say that there are support groups, there are grief therapists that can see you and talk to you about what you're going through and what you're experiencing to help you better cope with the situation. Long-term stress can also impact a person's mental health. So when a person is stressed for a very long period of time, this could cause like a constantly high level of cortisol, a hormone that is released when a person is experiencing stress. And so it's very important for a person to do everything they can do to bring down their stress level. So that includes like eating right, exercising, and also engaging in activities that can help just relieve stress. Physical disability, unemployment, drug and alcohol misuse, domestic violence can also impact a person's mental health, a person's mental health and cause mental health problems. And so I'd like to talk a little bit about domestic violence. This is very important. Like if a person is going through domestic abuse, it's very important to speak up and reach out for help, talk to a therapist, reach out to a support group, talk to friends, just so that they don't continue in this situation because this can really, really impact a person's mental health and even progress to causing mental illnesses and other things. And homelessness is also something that's very significant as well. And there are also resources that can help people who are unhoused or experiencing homelessness.
So, what are the ways we can take care of our mental health? While a lot of the resources that we have available include like health professionals, there are things that we can do every day to make sure that we're taking care of our mental health consistently and on a daily basis. The first thing we need to be mindful of is our food and exercise. It's important to eat right and be as active and exercise as often as possible. Another way that we can take care of our mental health is by making sure we um, continue to use our social network and our social support. Whenever we're going through a period where we're feeling lonely or isolated, it's important to reach out to the people around you so that you can feel strengthened by those bonds. Another way that we can take care of our mental health is by prioritizing our faith. If you have one, it's important to lean on the people in your community, in your church communities, and also to lean on God whenever you're going through a difficult time. It helps you to deal with everything that's going on with you in a healthy way and in a way where your mental health does not deteriorate. Another way that we take care of our mental health is by prioritizing sleep. When we sleep regular hours and we make sure that we are getting enough sleep every single night, it helps us to be restful, ready to face every day as it comes, and it improves our mental health. The last way in which we can take care of our mental health every day is by reducing or avoiding stressors that can cause stress on us, especially psychologically. So if you're ever in a situation where you know a person or a situation is detrimental to you psychologically, it's vital that you extract yourself from that situation if you can, so that your mental health does not deteriorate as a result of that person or situation.
Okay, so we've talked about just factors that can impact your mental health, and now we're going to talk about when to seek help. So if you or someone you know is experiencing any of this, it is time to seek help. And some of those things will include like changes in personality. And that would mean if you're like super like extroverted and you all of a sudden become introverted, it is a sign that you might be experiencing like a shift to your mental health and you might need to seek help. If you experience a change in your eating or sleeping pattern, sleeping more than you normally would, or eating more than you normally would, or less than you normally would, that would indicate that something might be wrong with your mental health. If you're experiencing an inability to cope with problems of daily living or just doing daily activities, and it is time to seek help. So if you're struggling with, like if you get really upset from being stuck in traffic, or you're just really upset from going to work, or you don't want to go to work, things like that, that would mean that something might be wrong with you and you might need to seek help. If you're experiencing loss of motivation, so you don't want to work or you don't want to get out of bed or even like brush your teeth, take a bath, do things that you would normally do very easily or do things that you normally would enjoy, that could be a sign that your mental health might be suffering and you might need to seek help. If you ever start to feel disconnected or withdrawn from your social network, or just intentionally withdraw yourself from participating in normal activities, that would be a sign that you might be experiencing some issues with your mental health and you might need to seek help. Experiencing excessive anxiety is also a sign, and that would mean having an exaggerated, like just anxiety response to something that wouldn't elicit that kind of response. Like being anxious because you have a big test or you have an exam is normal. But if you experience exaggerated levels of anxiety, that's something that needs to be given attention to. Prolonged sadness and depression is also a sign that you might be experiencing a mental health problem. And typically, they will say if you experience persistent sadness or depression for 2 weeks, then that's a sign. Extreme mood swings, so having super high highs and super low lows, that's not normal. I mean, these expressing mood swings can be normal for some women when they're going through their periods and just menstrual cycle. But if you see that you're experiencing that regularly in a way that you don't like, it doesn't make sense to you, that could mean that you might be experiencing some mental health problems. Experiencing excessive anger, hostility, or violent behavior is a sign that all is not well and that you need to seek help. And finally, having thoughts of killing yourself, harming yourself, or even like considering it or planning it, all of those things are signs that you're not okay. Thinking about killing other people or harming other people is also a sign that you're not okay and that it's time to seek help. So please, if you or anyone you know is experiencing any of these things, please seek help.
So now I'm going to discuss some of the myths around mental health. The first one is that struggling with mental health is uncommon. Research has shown that 1 in 5 US adults actually struggles with mental health or has a mental illness. So if you are struggling with mental health or you have a mental illness, it is not uncommon. There's lots of resources, a lot of very well trained people out there that can help you to navigate this. And it's not a situation that's unique to you. Another myth is that you don't need to see a therapist if you have friends. While, as I mentioned earlier, it's important to rely on our social network. It's also important to seek professional help when problems arise because professionals have the expertise, they have the training to deal with problems as they arise. So it's important to seek them out so that you can address the problems that you're having. Another myth that I want to talk about is that people with mental illness are violent. This myth in particular perpetuates stigmas around mental illness and mental health, and it makes people to sometimes treat people with mental illness in a way that is really not appropriate. Um, Research has shown that a very small fraction of people with mental illness will ever harm the public. And in fact, people with mental illness are more likely to be victims of violence than to be perpetrators of violence. So it's important that you treat people with mental illness with respect and dignity, and to understand that if you do have a mental illness diagnosis, that does not mean that you are going to devolve and be violent with anyone around you, any of your loved ones, as long as you're well taken care of and you are able to be on the medication and the therapies that you need to be on. The last myth we want to talk about is that mental health or illness does not apply to me, which is something that a lot of people think. While mental illness will not affect everyone in their lifetime, mental health is part of your health and it does apply to every single individual. So it's necessary that we prioritize taking care of our mental health. And if we do have anyone with mental illness around us, like family members or friends, which with the prevalence of mental illness in the US, it's very likely that you know someone or you will know someone with a mental illness. It's important to support them in any way that we can and to also take care of ourselves.
Finally, we would like to share with you some resources that you can use if you're struggling with your mental health or if you know anyone who's struggling with your mental health. And before I go into the list that we have on here, I'll just like to emphasize that you should talk to your primary care doctor if you have access to one. Talk to your primary care doctor about what you're experiencing and how you're feeling. And then your primary care doctor can go ahead and give you the name, number of a psychologist, a therapist, a psychiatrist, if you need those experts. So yes, please start with your primary care doctor if you have access to one. And if you do not have access to one, there are also some other resources that you could use to get help, the help that you need. And some of them are listed on here. There's a long list on the internet if you just do like a quick Google search, but here are some of the lists that, some of the resources that are like available to us here in DC. The DC Department of Behavioral Health. This is a very good resource because like if you call this number, if you or your loved one is in crisis, they will connect you to a therapist or a professional who can talk you through what you're experiencing. I think that's very important to be able to have that in time of crisis. The Mental Health Association of the District of Columbia is another resource that is very useful. That's their phone number. If you call that number, you can get connected to a therapist or any other expert that is available at that time to work with you. The National Alliance on Mental Illness, Washington, D.C., that's the chapter here. D.C., they have a helpline and the number is 988. If you call this number, you'll be connected to an expert, to a counselor who will be able to talk you through like things that you need to do and how you're feeling. And this resource is also very useful because they actually have a support group for individuals and their family members who are struggling. So please take advantage of this resource if you or your family member is struggling with their mental health today. And the last one that I would like to talk about today is Depression and Bipolar Support Alliance. I also think this is another great one because this support group is a real support group that you can actually go to in person if that's something that you would like. They have different meeting locations throughout the District of Columbia, and they meet every Thursday at 7 p.m. If you'd like more information about this support group, you could go ahead and visit their website. That's the link below. You will find information about their meeting locations, meeting time. You find their Zoom link on that website. So yes, thank you very much for listening and watching our presentation. We hope that you found that helpful. Thank you. Have a good day.